I'm Dr. Lawrence Jesuraj. I'm a cardiologist and electrophysiologist practicing at Kovai Medical Center, Coimbatore. My area of specialty is, as I told you, electrophysiology. This is a branch of cardiology where we look at heart rate, rhythm, and heart pumping related issues, what we call as heart failure. Heart failure is a cardiac condition or a disease where the pumping function of the heart is affected. Normally, if you see a normal heart pumps around 60 to 70% of the blood which is inside the heart. We call it as an ejection fraction. So around 60% of the blood which is coming inside the heart, inability to pump enough blood inside the body, we will call it as a heart failure. In usual terms, to understand, we can call it as a weakness of the heart. If you ask in Indian scenario, around 1 to 2% of Indian population may be affected by this condition. So close to 1 to 2% of Indian population is a big number. We are a 130 crore plus population. The number of heart failure patients in India is pretty huge. Heart failure can be due to multiple reasons. One of the most common reason is coronary artery disease. Otherwise, what we usually call as a heart attack. Whenever you have a heart disease where your blood vessels are affected, we call it as a coronary artery disease. And this coronary artery disease can be one of the most common reasons for heart failure. Other than that, uncontrolled diabetes, uncontrolled hypertension, or some genetic diseases can also cause heart failure. If you ask me, most common reasons for heart failure in our population, Indian population, I would say the heart failure secondary to coronary artery disease, there is blockages in the heart's blood vessels, uncontrolled diabetes, uncontrolled hypertension, maybe the most common 3 reasons for heart failure in our population. Heart failure is usually managed by multiple ways. One of the most important thing is lifestyle modification. Most important thing, as I told you, control of your diabetes, hypertension, and if you have a coronary artery disease or blood vessel blockages, that has to be corrected. When you have corrected all this, still you have a heart failure, then we follow few important lifestyle modifications. One is reduction in the fluid intake. Your doctor will tell you how much of fluid you can take according to your pumping function of your heart. Normally, you know, everybody says you have to drink a lot of fluid. But heart failure is one condition where you usually restrict fluid intake. A lot of times, we'll ask the patient to take 1 to 1.5 liter of fluid per day, depending on the heart pumping function. We'll ask them to restrict salt also. This is in basic about lifestyle modification. Otherwise, you have drugs. Excellent drugs right now available for management of heart failure. We have drugs like beta blockers or ACE inhibitors, and there are newer drugs which have come in the management of heart failure. When the patient is not able to be managed with drugs, in spite of all the drugs, still patient happens to be in heart failure, which is symptomatic, then we have newer modalities of treatment like what we call as a cardiac resynchronization therapy. This is one form of heart failure therapy where we put something called CRT device, which is like a pacemaker. We put inside the below the level of skin, and we connect with 3 wires which are connected to the heart. We call it as a leads, which can make heart to pump in a better way. When all these fails, you tried lifestyle modification, you tried drugs in a good way, and you have tried CRT in an eligible patient. In spite of that, if patient remains symptomatic, one last and final hope of treatment may be heart transplantation. But most of the patients, if they are good and they are compliant with the drugs, they meet their doctors regularly, follow what doctor says, can be managed medically with drugs and lifestyle modification, with few of the patients requiring some form of device therapy. See, the most important thing is I always say for a heart failure management, 2 things are very important. One is from patient point of view. One is regular monitoring. Second is compliance to the drugs. By regular monitoring, what I say is One of the very easy way to monitor your heart failure is looking at your body weight. This is a very easy way. Yeah, all of my patients who have a heart failure, I ask them to buy a weighing machine and keep it at home. They monitor their weight. We know very well gaining of weight. If you gain weight over a period of 1 to 2 weeks, 1 to 2 kg, we know there are multiple reasons to it. Your food intake, nutrition, a lot of other factors make a role. But if you gain a weight of more than 1 to 2 kg over a period of 1 to 2 days, that means you have accumulated a lot of fluids in your body. Heart failure patients tend to accumulate fluid inside the body that causes them breathlessness. They will not be able to breathe properly during rest or during exertion. One of the most common reason is accumulation of fluid. This can be monitored simply by looking at their weight. If they are able to do, they can monitor their blood pressure and pulse rate. They can keep a note of that and keep a close watch on that and keep your physician informed. And more importantly, be compliant with your drugs. Take drugs as told by the doctor regularly, and most of the heart failure patients may require frequent visits to hospitals. What in our hospital, in KMCH hospital, what we have made is we have a specialty clinic called heart failure clinic, where we have made such an arrangement that most of the patient can be managed without coming to the hospital by communicating with our heart failure clinic. We have a specialized nurse and heart failure specialist available who can take care of most of the basic complaints or symptoms. They can communicate with the particular heart failure nurse, and they can easily coordinate with them how to manage them. And we usually call the patient 1 to 2 months intervals and optimize the drugs. So if you ask me what patient have to do, one, take your diabetes and hypertension well under control. Two, make use of your lifestyle modifications as advised by the physicians, and monitor your vitals, particularly your weight. And more importantly, be compliant with your drugs and be in regular follow-up with your physician. Heart failure is very much treatable disease, and there are few patients where there are possible reasons can be corrected, can be curable also. But most of the heart failure is treatable. So be compliant with your physician and drugs. You can do well. To make your heart stronger, by which I mean that you improve the cardiac function, you have to take care of your risk factors. As I told you, better control of diabetes, better control of hypertension, and there are excellent drugs right now available for management of heart failure. Your doctor will advise the drugs according to your hemodynamics, that is your pulse rate and blood pressure, and monitor them very regularly by your physicians. If you take your drugs properly, and if you take care of your risk factors like diabetes and hypertension and other coronary artery disease properly, definitely you can improve your pumping function. Thereby, you're making your heart stronger so that you can have a near normal life like any others.